more biologically vulnerable to psychosis and to even worse psychotic episodes. Now, in my opinion, at that time, 1979, you had this coalescing of information that, frankly, I think the medical establishment needed to respond to. Because again, they had nothing left over here in the aggregate as to why this was benefiting patients on the whole over the long term. We knew we had tardive dyskinesia, Parkinson's, emotional lethargy. A lot of patients didn't want the drugs. And we didn't even have, over the long term, at least in the aggregate, a sense that it was knocking down psychosis. So we lost the rationale for the drugs, again, at least as used for all people, all time. And at the very least, you had to come up with a paradigm of care, in my opinion, that would involve selective use of the drugs and the recognition that in these placebo studies, at least 50% or higher of the patients treated with placebo got better and didn't relapse in that time. Obviously, you have an obligation to those people to not push them down this chronic path. Now, do we have confirming evidence that indeed this paradigm of care is increasing the likelihood that a person who suffers a psychotic break, gets diagnosed with schizophrenia, will become chronically ill? Because that's basically what you're seeing, and it goes back to this original thing. Why are we getting more disabled people, unable to work, chronically ill? We have two forms, I think, of very powerful confirming evidence. One was the World Health Organization studies that compared outcomes in the US and other rich countries with outcomes in the poor countries of the world. Now, they did these studies twice. Now, they initially did, I think it was a 5-year outcome study, and they found that outcomes in the poor countries of the world were much, much better. And again, you start to see a certain figure pop up. Roughly 65% of the patients diagnosed with schizophrenia by Western standards at that 5-year outcome were doing well, having a good outcome. Now, what do we see in the United States and other rich countries that adopted our paradigm of care, which was basically continual medication? We saw only about 35% had good outcomes and 65% were chronically ill. So we saw a shift in the outcomes. Now, the researchers said, how could this be? But if they looked at their own NIMH-funded research, that's what they would have expected, because that's what their own drug studies, their long-term studies, were telling them, is you're going to increase the likelihood that people will become chronically ill. Anyway, the World Health Organization sort of said, oh, how could this be? So let's, and Western doctors, American doctors, because obviously it was a real slap about the merits of this, our form of care. So they redid the study. And they sort of tried to answer sort of the criticisms of the study. Well, maybe we're not comparing apples to apples. The people you're diagnosing in the poor countries are different than our schizophrenics, so to speak. And so they were very careful about who got entered into this new study. They even did subtypes of, I guess, symptomatology. And guess what they found again at 2-year outcomes? Basically the exact same thing. Good outcomes in at least 60% of the patients in the poor countries, whereas in the United States and the other rich countries, you saw the great majority became chronically ill. Now, by the way, the best outcomes by far in this study were in rural India. And you want to know, what do they do in rural India? Well, one of the things that was hypothesized, let me now step back. As the WHO researchers tried to say, well, why do we get this difference in outcomes? They said, what's the variable? And they said, well, maybe it's family involvement, working on farms, social things, etc. But they also put forward this hypothesis. Maybe the patients in the poor countries of the world are better at taking their drugs. They're not resistant. So whereas we get, Americans, and they're not very compliant, maybe they're very compliant in the poor countries. So they checked drug use. And what did they find with drug use? They found in the poor countries of the world, where outcomes were much better, that only 16% of the patients were regularly maintained on drugs. Overwhelming majority not maintained on drugs continuously. And that was the place where the better outcomes were. And then the researchers, by the way, in a little footnote said, well, even the 16% isn't really real, because people were telling us, yeah, maybe they were giving drugs, they weren't taking the drugs. They actually thought it was more like 10%. And where were the best outcomes? Rural India, almost nobody maintained on drugs there. And that was the best recovery rates you saw. And there was one thing, two things in the WHO studies that I thought were so damning. The researchers concluded, well, there were two things. One thing they said, when they went to the poor countries, it was amazing how involved those patients were in